evening, everyone. I'm so glad you could come here tonight to listen to my presentation on nursing. Nursing as a profession is a very rewarding vocation. For those of you who have not made up your mind about what you're going to do in your future, I hope you'll really seriously consider nursing as your profession. I feel that I have a very unique perspective to offer you on nursing, since I have experience, and much experience, from both sides of the bed. I had a 30-year nursing career before I wound up in this chair. Let's go over a little bit of the history of nursing to start with. Many, many years ago, the nurse was known as someone who took care of children. That's what today we would call a nanny. Then after that, nuns and the military provided much of the nursing-like care. And then we have a woman by the name of Florence Nightingale. She took it upon herself to improve the care for soldiers who were injured in the Crimean Wars. She then wrote the first ever book on nursing and even started a nursing school. She had many traditional Christian values and also other values that we would today consider before her time. She believed in professionalism for nurses and also in autonomy. Autonomy just means that the person is able to use their own education and experience to make decisions on their own for the care of their patients. Autonomy is a very modern concept. Next, let us go over some of the education that it takes to become a nurse. First is the LPN, or LVN, 1 year of education, and then an exam and licensure in her state. Then you can go to a 2-year nursing program, or a bachelor's in nursing, and then even an advanced practice where you can take the place of a doctor. Excuse me. There are many, many subspecialties in the area of nursing. Some of those are the neonatal intensive care, who's taking care of patients right from birth, then to the pediatric nurse, which is where my experience was in both of those areas, and then through adult nursing and through all the way to end of life. In that, there are also many subspecialties. The nurse will always be in demand. She has a very good profession where she will make a good salary and have good benefits. According to the U.S. Department of Wage and Salary, they started somewhere around $40,000 a year for an LPN, up from there in accordance to what your level of education and experience was. Within the job, there would be many opportunities for a nurse to share her faith. Remember that Christ always honors evangelism through service. So hopefully I have been able to influence you and let you know how good the area of nursing is. Thank you.